Good afternoon, everybody. Today we're going to talk about something which is no longer just nice to have, but I guess it's quickly transitioning into a key operational priority across industries, especially safety critical sectors like aviation, public health, healthcare, public services. And if I may add a bit of a personal note, I hit a wall about 4 years ago after some 18 years in mainstream journalism. I wish we had a panel like this 4 years ago, and maybe I could address some of the burnout that I faced then. But better late than never. I'm glad we're having a conversation finally, and I'm joined by an amazing panel of guests today, some of who's flown all the way from Portugal, from Melbourne, and of course we've got Khulud and Joan, who are going to tell us the Dubai story. Let's quickly get this conversation rolling. All of you are working across sectors in making your organization more mentally fit. That's not something we often talk about. Let's start with Khulud. Khulud, you are the Director of Total Rewards and Employee Engagement at the Dubai airports. You handle a diverse group of employees. You know, Dubai is representative of that. We are home to some 200 nationalities. How are you making some real operational impact through your work on a daily basis?
When we look at employee well-being and employee health and wellness in general, it's not only about mental health, right, at Dubai airports. So we want to create that culture where organizations are thriving. And it's not only just about addressing burnout, for example, but it's more of a holistic approach, a proactive and intentional plan that you have to support your people and create that thriving culture. Let me give you an example. In Dubai airports, we make sure that we have the right foundation to support our people. That comes through our policies, that comes through our processes. For example, we have wellness days for those who need to take it. We have direct access to mental health support. We have our policy for remote working, which supports work-life balance. And these are just few examples. So as I said, having the foundational as policies and procedures that support that culture is very important at an organizational level. And then secondly, we move to talk about how to embed it within your day-to-day practices. So throughout the year, we have that holistic plan that looks at different elements of well-being. And when we talk about that, we look at financial well-being, social well-being, career well-being, physical, mental, and so on. So it's more of a fully rounded approach towards our employees' well-being. And what we have noticed is that once we have done that, we have seen results. So our employees had higher productivity, better engagement, higher resilience, and definitely a better customer service, which is a non-negotiable for us at Dubai Airport, serving around 92 million passengers yearly.
Yeah.
So that's
and you're hitting 100 million hopefully next year. So
yes, absolutely.
Huge numbers, yeah.
So we need to make sure that we continue to support our people the right way by providing the right culture.
Absolutely. Dr. Juram, you also represent the other side of Dubai. You're from the Dubai Healthcare Authority, the DHA. Public health is also a very important facet of how Dubai operates at a global level. What real changes are you seeing?
Hello everyone, it's so nice to be here with you today. Thank you so much, AB, for this question. From a public health lens, we look at human behavior as the product of a system design, right? So we don't blame people for having obesity or diabetes or hypertension. We look actually at the environment that shape the behavior and the choices of these people. Yani, in other words, do they have access to healthy food? Do they have work-life balance? Can they exercise? What's their exposure level to stress, right? And same thing applies for well-being in the workplace as well. Because it's not a question of one individual resilience. It is actually an institutional determinant of organizational mindset and culture and leadership norm and policies, right? So in order to really make well-being at an institutional level, I highly believe that we have to shift from fixing the crisis to a proactive mode. Yani, in other words, instead of trying to see how we're gonna fix burnout, we need to think of designing an environment that prevents it happening from the first place. Exactly. You know what I mean? Yeah. And also, there's one thing that I also have to highlight, because 2 days ago I was speaking at Forbes Health Leadership Summit in Abu Dhabi, and I was talking about surveillance and data intelligence, right? See how we in public health, we monitor the trends, we check on the outbreaks, we check on the level of vaccination, right? And we detect early signs so we can prevent the crisis before it emerges. I believe same concept should be applied when it comes to well-being at the organizational level. There need to be a continuous evaluation, anonymous surveys. We need to check the level of absenteeism, the turnover, how many people are resigning in your organization. And all that has to feed back on a dashboard that the leadership and HR has access to, and they analyze these patterns and they take action, right? So if we don't do this, I can assure you, no matter how many application or wellness application you do, how many days of retreats you do biannually, weekly, monthly, awareness, mindfulness session, this will not help. It has to be at an institutional level and shift from treating the disease,
preventing it. Let's bring in Hugo at this point in time, who's been quietly listening at the far end. Hugo, you are a former pilot as well. And maybe you can give us a very interesting perspective as a pilot, also training director at Portugalia. How are you bringing some real measurable changes to efficiency because of well-being?
Well, thank you for the invitation. It's quite a privilege to be with such distinguished panels. I've been listening carefully, because everything that's been said is quite on point. We need to detect first. We need to prevent instead of treating, because it's much easier to prevent. And I'm sure that everyone here prefers to spend some money preventing an accident than rather take care of a company and the families of those who are lost in an accident because prevention didn't happen. On a practical point, because it's very important to have policies. The company needs to set up a policy, and policies bring environment. But the environment needs to be sustained. People need to be trained to recognize their own necessities when it comes to mental health. And for that's where training comes into place. We need to spend time and invest, because it's not an expense, it's an investment. We need to invest on training people to recognize, first of all, their own signs of mental fatigue, of mental health, to give them the tools for them to know what can they incorporate in their own private life, what they eat there has an impact on the mental health, the way they do exercise, the time that they do the exercise, the sleep, everything comes into place. But you need to let people know, they need to learn about this. Let me just share a very important program that we implemented in Portugal Airlines. We recognized that pilots, when they were away from work for quite a long time, they became very stressed on the returning to flight. So we implemented a program called People's Resilience Program that sets as a mandatory meeting with the training responsible. The person designing the training for that pilot needs to meet with that pilot before deploying the training. And the first thing that we ask the pilot is, what stresses you the most on your return to the flight duties again? So we create a safe environment where the pilot has the opportunity to say, you know what, the standard training says that I need to go back to the simulator, that I need to do this flight and that. But I also feel that I could do some observation flights, or I would like the opportunity to talk with the maintenance department because I have some doubts about this or that. So we create a safe space for the pilots to say, well, I need more training in this specific area or that specific area, because one size doesn't fit all. And the law, the regulations are very strict to say if you're away from flight more than X amount of months, then you need to have this training. And it's very easy for a company to say, well, EASA or FAA is very clear on this. If you're away from flight, then you have this program. but that doesn't fit all. Some people have different difficulties, and the fact that when they return to service, they know that they're going to have a space to talk about their stress, what makes them unease on the return, has shown very promising results amongst our flying team. And so much so that in 2026, it's going to be rolled out to the cabin crew as well, and later in 2026 to the maintenance personnel. So everyone will have a chance on returning after, well, we set that 120 days, which seems to be, for us, a reasonable amount of period where these stress levels of being absent start to set. So it's going to be rolled out. It's been quite successful.
Very interesting perspectives there. Let's bring in Mabel, who's been quietly waiting as well for her opening remarks. Mabel, you've worked for a long time in the UK. You're based in Melbourne now. You can possibly give us a very, very diverse observation globally. I'm glad we're talking about different training programs that exist. What sort of blind spots that are still there that you worry about when it comes to mental health in organizations?
Thank you for that. Thank you everyone for this talk. When we talk about blind spots, having worked in the UK, then I moved to Melbourne, Australia, and I'm also now in the Middle East. I'm coming with a lens of the mental health clinician, mental health expert. And what we're seeing in the high pressure industries is what my organization focuses on. Mental health still remains an abstract for these industries. It's something that's really challenging for them to operationalize. So whilst well-being and mental health seem to be a buzzword, now how do we roll that out into the day-to-day running of organization, into aviation specific? And I think that's the major gap. I think since COVID, the awareness is there, awareness is high. Individuals, companies, organizations are aware that, we need to be taking care of ourselves. But now the leaders are at the stage where, so how do we do that practically? And I think that's where our company comes in now with the mental health lens that, it's not so much as a well-being pillar on its own. It has to be implemented into the operation of the organization. What are you doing day to day? What are you doing month by month, throughout the year? It's not about October when it's the Mental Health Awareness Day. It's actually understanding and measuring. We're really big on measuring. How do you know whatever you're doing is working for the people?
Yeah.
And we often identify a gapping, right? And the rest of the organizations, they don't know what programs are there, what access they have to services. So it's really having the mindset that let's ask the people, what do you want and what can we implement? And when we've implemented something, is it working? So we spoke about the continuous evaluation of whatever we've rolled in place. So we need data. We need to be understanding at an organizational level. Do leaders know how to start these conversations? Mental health is a huge stigma, and that's just not by organizations, that's the world. There's a stigma that comes with mental health. As long as I'm mentally labeled, I'm unfit for work now, or I'm not the next person for promotion because I'm considered unfit for work. But that is not necessary. There's a spectrum, right? Obviously, there's safety that we need to consider. So there's a spectrum at the end that this person is probably unfit for work, so maybe they should not be taking certain roles. But before that, there's a lot that can be done before that, early detection. So are the leaders able to support themselves, right, and support the team in identifying early onset of signs? So we talked about health prevention, right? What are we doing? Are we having these conversations? Hugo mentioned, eating right, sleeping right. What's the sleep pattern? We know the workload of aviation, right? The remote working, the long hours. How are we supporting people's recovery? If they're recovering in a hotel, that's not full recovery versus when they're at home in their own bed. So data is really important to be measuring the organizational level, the conversations, understanding what do we have in place to actually measure everything that we put in place so that, again, we can evolve. Because if you can't measure something, then you can't improve anything.
Absolutely. I'm amazed that you mentioned leadership, the role that they play. In fact, let's bring Khulud back in the conversation. You've spoken about a culture at Dubai airports, and you're already building, you're working towards a future, which a lot of us may not really know what it may look like at this point in time. One of the key pillars is mental health. I was just looking at an old report, 2025 report. Almost 80% of UAE's workforce do not have access to help when it comes to mental health. I'm sure Dubai airports is drastically different. Tell us how much do the leaders, what sort of role do the leaders play, and how important is their role in it?
Absolutely, Abby. So just to echo a few points that my fellow panelists here have mentioned, that we already apply in Dubai Airport. So we do always apply those listening strategies. We make sure that it's not a one-size-fits-all product, right? So through different surveys, we capture our employees' feedback to see basically what are the things that they want, what kind of support they would like to have more. And then while we are taking a holistic approach, we do dial a bit more on that specific area where it came up as a concern or feedback from our people. A second thing that I would like to highlight is the role of leadership, as you correctly mentioned. We have an open door policy. People can come, they can share their feedback anytime. And going back to the social learning that Hugo mentioned, is that we already create those safe spaces for people where they can come, they can talk about their challenges, not only within Dubai airports, but we will have a program that we call 1DXB, which extends to the entire airport community. And that's basically where we bring working groups together. They can talk about their challenges, address them in a respectful manner, and agree on a way forward. That creates a continuous learning for the entire community, yet in a very safe space where they can, share their ideas and practice. And I think that's something that have worked very well for us. We have more and more members joining that community on a daily basis, and we're very proud to provide that for our people.
I'm sure. Joanne, do you want to add a bit towards that, the role the leadership plays at DHA?
Ade, I always say that no matter how competent and brilliant and huge achiever a leader can be, or a person can be, he might not be able to manage people well. So I always recommend organizations to choose carefully their leaders, or at least train efficiently and measure the outcome of the training, because awareness campaign, we all know that very few of them, or very rarely, it can change a human behavior. Unless there is an accountability, and unless we shift from well-being being a governance issue, not just an HR activity, right? Or a slogan that is hanged on the door or on the wall of an organization, right? So choosing and training the right leaders actually to be emotionally intelligent, to have the skills of, or to be trained for trauma-informed communication, to actually accept that people working under them having different opinion and have respectful disagreement. All these indicators and the leader behavior, I believe it is the strongest indicator whether well-being and psychological safety will thrive or collapse in an institution.
Absolutely. In fact, I was going to also ask you about the lessons you get. You are in a space which is very different to aviation, public health. What's the systematic approach that others must learn from someone like you in public health?
Abe, we at DHA, we have a whole mental health strategy and a huge budget that has been dedicated for mental health. We run awareness campaigns to every possible population and subpopulation that might be at high risk of mental distress. We also train general practitioners and physicians actually to detect early sign of depression and anxiety. We also put a regulation, SOP, and we have we are creating ambassadors actually in governmental entities that are trained for mental health first aid. And we have done so many workshops for mental health first aid for first responders. What I truly believe that mental health and well-being, it is a social responsibility, and there is no sector can carry this alone. From public to private to community, all of us can do something about it, and we are a very important player in actually creating this ecosystem of psychological safety and embracing the culture of well-being to become not just an initiative, but encrypted in the DNA of every process.
Yeah, like you rightly said, yeah, it has to be a holistic change, a cultural mind shift, let's call it that. Hugo, you've already spoken about some of the trainings that you've included as part of the curriculum, let's call it that, the employees go through. Why did you do that? At the core, I'm sure you must have realized the amount of loss. World Health Organization says globally there are 22 billion work days that are lost due to burnout. Almost $1 trillion in economy that takes a hit. I'm sure you realized all of that when you planned this.
Of course, and the industry knows this. This is data that the industry knows well. How much does it cost when people don't come to work?
Yeah.
But how much would it cost for those people to come to work not being well? So that's a cost that we have to support.
How do you balance that? You know, people have to come to work, but they're burnt out. How do you address that? How do you make sure the operation continues?
Create the policies, the environments, and have the leadership that diminishes the stress that is present. I mean, a lot of professions, if you ask everybody, they will say my profession is the most stressful of all. Pilots aren't different from that. They always say, well, I have a super, many others do. But the fact is, as well said, mental health is a collective responsibility. We need to be more aware of the things we say to one another. We need to be more aware that despite you having a difficult profession or a high responsibility, it is okay for you not to feel well that day, to stay home. So I'm not happy for those people who stay home when they are not feeling well mentally, but I'm happy that they still work in a company that allows them to do that. Because I'm much more concerned about those that come to work stressed and the impact that would have. The fact that it is a collective responsibility means that collectively we have to do a lot about that. Sensitive training is important. I come from a society that says Latin, so there's still the macho figure, especially in aviation. You know, I used to joke that the airplane has such a big door. If only one person comes at a time, why is it so big? It's because the pilot needs to go in with his ego.
Yeah.
And we need to work with that. We need to be aware of the people we are working with, and we need to accommodate some of their special needs. And we need to work around that. And so it's very important that organizations set programs, as well said. We have the peer support program, where a pilot can just pick up the phone and call to another pilot, who's someone that will understand their needs. The dialogue is inter-pair, so it's important. But most important, I have to agree with this, is the leadership of the company. They need to say, well, I'm okay staying home today. I'm the CEO and I'm not feeling well enough to go to work. I'm not feeling well enough to lead this company, and that doesn't make me any less than those who are feeling well this day. We need to normalize mental stress. We need to normalize fatigue, and we need to analyze it, see what's the root cause, and work on the root cause, not on the individuals. Otherwise, we're just running after the rabbit, and we'll never catch it. We need to normalize mental health. I'm okay not going to work if I have a cold. I should be okay not going to work if I'm feeling extremely fatigued or I'm feeling blue that day. And that shouldn't be frowned upon by my colleagues as well.
I think you've said it. We need to normalize mental fatigue, and I think that's my key takeaway. We're unfortunately running out of time. We've just got about 3 minutes. So Mabel, in a closing remark, is the normalization happening? If yes, what's your take on that? How do you see it?
I think it's starting to happen. I mean, look at before in aviation, we wouldn't be having this conversation. So I think it's starting to happen, and I'm really excited about even throughout the expo, throughout this 5 days, the conversations I've had with operational leaders, with CEOs, is they wanted to do more for their people. Yes, there's the compliance issue, but for me, it's more about you wanting to do more for your people, that care for your people. I think it's there, and so it's not that we're in that place now. What's the next level? And I think the next level now is actually to put into place everything we spoke about today, you know, to having the data, to be measuring, to be putting these things in place, to check with the people, are things working, and to actually offer the next step in terms of stigma is still a big issue for me. Pilots can get grounded, but I was having a conversation with the US Army yesterday, and they said, you know what, that has to be removed. There has to be a place where safety, they can take medication, and be monitored and still fly. Safety is being monitored, but normalizing, right? That this is the way life is. We're in a stressful world. I'm in a stressful industry. I work crazy hours, right? I'm in this cockpit for a long period of time, right? But then I can still work and still be supported and still continue on with the day-to-day operation of the life.
Absolutely. Khulud, quick take on the culture that you've built, you're building for the future. We spoke about capacity, 100 million next year, inshallah, and then the bigger airport that's coming up in about 7 years' time from now. What's the next step forward?
I think it's about creating that dual partnership, I would say. So yes, as an organization, as an employer, we do have a responsibility toward our people, but also we want to highlight the role of our people into taking care of themselves. So that's something that also I would like to highlight, that self-awareness is key. Know when you need the rest, as Hugo mentioned, that you need to know if you're not feeling okay today, and to be able to, say that I don't think I need to come to work today because I need to take care of my mental health. And as an organization, our role is to provide that safe space for you. So it's really a dual partnership. It's not a one-way relationship, if I can call it that way.
Absolutely. Joanne, quick take from you as well. You've been very vocal how DHA has been talking about mental health. What's the next big thing you're working on?
I believe if we just endorse accountability and we report, and we monitor the well-being indicators and we report any crossing of the line, I think that these has to be reported exactly as we report the operational or financial risk, and take it seriously and have a mitigation plan, because every organization is responsible for the well-being of their workforce.
Absolutely. Hugo, one last remark. What can be done better?
I think we must assess more and better, have indicators that are clear throughout the entire company, and make management more aware and more accountable.
Brilliant. Thank you very much, ladies and gent, for your wonderful insight into the world of mental well-being at an operational level. Thank you very much for patiently listening to us. Unfortunately, we're out of time for this one, but hopefully when we come back around for the next Dubai Air Show, I'm sure we'll have a lot of interesting stories to hear. Thank you for today.